Hello, my name's Cory. This is Ashley. We're going to be doing the assessment today for our health and physical assessment class. Okay, Ashley, I'm going to be talking to the viewer and to you. Okay, and I'm going to be explaining what I'm doing as I go throughout, and I will have to lay my hands on you. Is that okay? Okay. So first thing we're going to do here is go ahead and assess Ashley's head. Okay. First thing we're noting is the shape of Ashley's head. It is round and it seems proportioned to Ashley's body here, okay? The term we would use in the medical field is normocephalic. I'm going to go ahead and touch your head, okay? And what I'm looking for are any lesions or tenderness, okay? I do not feel any bumps or lesions on Ashley's head. Did that hurt at all, Ashley?
No.
No. Okay, so no tenderness on palpation. Hair is evenly distributed across her scalp and normal with that, okay? I'm going to go ahead and move to Ashley's face. Ashley's facial features look symmetrical. Eyes, nose, lips, and her ears there. Can you go ahead and smile for me, Ashley? And frown and puff your cheeks out for me, okay? So Ashley has full range of motion of her facial features there. I'm going to go ahead and palpate your face here. Is there any pain with that? No tenderness. Can you go ahead and open your jaw for me and close it? All right. So Ashley has full range of motion of her jaw. No cracking was noted. Was there any pain?
No.
No pain with opening and closing her jaw there. I'm going to go ahead and move to Ashley's neck and shoulders here. Okay, so we're going to be checking her muscle capacity with her neck and shoulders. Okay, I'm going to have you push against my hand here. Okay, and push against on the right and lean your head back and push your head forward. Okay, so Ashley has full range of motion of her neck, and I'm going to have you go and rotate your head there. Okay. And then I'm going to have you raise your shoulders here, okay? Ashley has full range of motion of her neck and shoulders. I'm going to go ahead and inspect your mouth here, okay? And I have a pen light, just a little light here, okay? Open your mouth, okay? Ashley's oral mucosa is moist, and it looks like her lips there's no dry skin noted. And have you had your wisdom teeth removed?
I have.
Okay, so Ashley would have then 28 teeth, which is is normal in adults. I'm going to go ahead and check the mobility of your tongue here, okay? And you can stick your tongue out for me and push your tongue up and down and to the right and to the left. All right, Ashley has full range of motion of her tongue. I'm going to go ahead and inspect your nose and your sinuses here, okay? So nose appears to be symmetrical. I'm going to go ahead and palpate your sinuses. So your maxilla sinuses, any pain with that?
No.
No? And then your frontal sinuses, any pain with that?
No.
No? Okay. So Ashley's nose is symmetrical. As we stated before, her facial features are symmetrical. I'm going to inspect your trachea here, okay? So Ashley's trachea appears to be midline. Easily movable here. Is there any pain? Okay. All right. So that concludes the head, face, neck, mouth, nose, and sinus assessment. Next, we're going to finish up by establishing nasal patency. So Ashley, I'm going to have you go ahead and take one finger and push on your right nasal passage, okay? And breathe through the left. All right. And the same thing on the other side. All right, so both nasal passages are patent. I'm going to go ahead and move to the heart and neck vessels here. Ashley is going to be doing about the same thing, palpating different areas and then listening with my stethoscope here, okay? So the first I'm going to be looking for PMI over the precordium here. So I'm just going to place my hand on your chest and feeling for that point of maximum impulse. And I do not feel any impulse due to the clothing that Ashley has on here, okay? I'm going to go ahead and listen to the spots that we can hear S1 and S2 on Ashley's chest here, okay? I'm going to be first using the diaphragm of my stethoscope, and then I'm going to be moving to the bell of my stethoscope, okay? And we're listening to 5 different places here. The first one is the aortic spot. Next is pulmonic. Next is Erb's point. Next is tricuspid. And then finally the mitrals. All right, I'm going to go ahead and move to the bell of my stethoscope. You can hear the finer sounds with the bell. Again, over the aortic, the pulmonic, Erb's point, tricuspid, and mitral. All right, no bruits or murmurs were noted. Clear S1 and S2, which is what I would expect on the cardiac assessment. And I did note that I hear S1 over the mitral area, which is a normal finding. And S2 was best heard over the pulmonic valve, which is a normal finding. I'm going to go ahead and move to the carotid artery, which on either side of the trachea. I'm going to go ahead and palpate first, feeling for a thrill, which would be like turbulent blood flow. And you do one at a time as to not include both at the same time. I'm going to go ahead and assess the other side here, the right side. All right, and again, good pulse felt, no bruits or turbulent or thrills or turbulent blood flow noted. I'm going to go ahead and auscultate the carotid arteries with the bell of the stethoscope. All right, Ashley, I'm going to have you take a deep breath in and hold it. And you can let that out. And another deep breath in. So the right side here. All right. Just a good pulse. Heard S1, S2, and no bruise. So lastly here, we're going to be inspecting or assessing the respiratory system here. Okay, so first I'm going to assess the rate. I'm going to place my hand on Ashley's shoulder here and just feel her inspirations and expirations for 30 seconds. So in 30 seconds, Ashley took 8 breaths in, multiply that by 2, that would give you a respiratory rate of 16 breaths per minute. Go ahead and just observe Ashley breathing. There appears to be no distress, no accessory muscles used or position and posture or upright. I'm going to go ahead and just palpate Ashley's chest and back just to see if I can feel any pulsations during inspiration here, okay? No pulsations noted in the anterior. Go ahead and do that next here. Posterior. All right, so then I'm going to go ahead and palpate and assess for the expansion or respiratory excursion. Okay, and I'm going to do that by placing my hands on Ashley's back and asking her to take a deep breath in. Okay. Alright, so the expansion, when Ashley's taking a deep breath in, was symmetrical, bilateral. Alright, so I'm going to go ahead and palpate for tactile fremitus. Using the palm of my hand, I'm going to go ahead and lay that on Ashley's back here and have her say the word 99.
99, 99, 99, 99, 99, 99.
All right, so vibrations were heard throughout the lung fields of the posterior lung fields here. I'm going to go ahead and percuss. Do that also posteriorly here. So that's just actually you're going to feel my one hand here, and then I'm just going to be tapping. I'm going to be looking for a clear hollow sound. Okay. Clear hollow sound was heard throughout the lung fields. I'm gonna go ahead and auscultate breath sounds, starting with the bronchial. That's best heard over the trachea and the two main branches of the bronchus. Do you mind facing forward here for me? I'm gonna use the diaphragm of my stethoscope. Take a deep breath in for me. Alright, I'm going to go ahead and assess the bronchovesicular sounds. Right, and lastly, the vesicular sounds, which are heard on the outer regions of the lung fields here, okay? I'm going to have you put your hands on your hips here and listen to the lateral sounds. And lastly, the posterior vesicular sounds. Okay, and you can see that we're moving back and forth, assessing side to side, just making sure everything sounds equal bilaterally. Bronchial sounds usually sound a little bit louder, and they get quieter as you go down through the sounds there. Last thing I'm going to do is check for bronchophony. I'm going to have Ashley repeat the words 99 again while auscultating with the diaphragm of my stethoscope. I should hear soft, muffled, indistinct words, knowing that Ashley is saying something but not knowing exactly what she is saying, okay? So, I'm going with the pen here. And have Ashley repeat 99.
99, 99, 99, 99, 99, 99.
Alright, so again, that was soft, muffled, and indistinct as I went through the lung fields posterior to